Welcome to Study Session 2, Nutrition Methods and Procedures. Introduction. Nutrition is the process of absorbing nutrients from consumed food and processing the nutrients in the body in order to provide energy, maintain and repair tissue, integrity and regulate body process. There are many nursing methods and procedures in nutrition. This study session will focus on optimal nutrition for clients, hospital diets in patients' care, and finally, alternative feeding methods. Learning outcome. When you have studied this session, you should be able to 1. Identify nursing interventions needed for optimal nutrition for clients. 2. Identify the terms used to describe the different hospital diets in patients' care. 3. State the different alternative feeding methods, its purpose and indications. Optimal nutrition. Nutrition is the process of absorbing nutrients from consumed food and processing the nutrients in the body in order to provide energy, maintain repair tissue, integrity and regulate body process. The consumed food can be ingested orally, through the mouth, through a nasogastric tube, inserted directly into the stomach, intestine, gastrostomy, jejunostomy, and intravenously in parenteral nutrition. To maintain health and facilitate patients' recovery from illness, nurses therefore have the responsibility to promote optimal nutrition and a balanced diet for the client. In this light, nursing intervention includes the following. 1. Provision of an atmosphere that encourages eating. 2. Serving of meal or diets to the client. 3. Assisting or feeding the client with a served meal. 4. Monitoring client's appetite and food intake. 5. Administering enteral and parenteral feedings. 6. Monitoring and evaluating for possible signs of nutrition problems. 7. Collaborating with physician and dietitian about the diet order and information on patient's diet respectively. Hospital diet. Different terms are used to describe the diet served in the hospital in the management of patients, namely regular diet or standard diet. This is a balanced diet served to a hospitalized client who has no special diet needs in relation to the treatment of a disease process. This diet supplies the metabolic requirements equivalent to that of a sedentary person, which is about 2000 calcium. Special diet. This is a diet that has been altered or modified, either in texture, kilocalories, specific nutrients, or consistency for the management of a disease process. For example, diabetes mellitus, renal failure. Light diet. This is a plainly cooked diet with a minimal amount of fat and fiber, designed for clients who are not ready for regular diet and postoperative patients. Soft diet. This is a low-fiber diet that is easily chewed and digested and ordered for clients who have difficulty with chewing and swallowing. Clear liquid diet. This diet is limited to water, tea, beverages, clear fruit juice, and so on, that is provided for clients after certain surgeries or acute gastrointestinal tract (GIT) infection, usually to relieve thirst, prevent dehydration, and minimize the stimulation of GIT. 6. Full liquid diet. This is a liquid food or diet at room temperature provided to clients who have GIT disturbances or clients who cannot tolerate solid or semi-solid foods. Diet as tolerated. This is diet ordered based on client's appetite, ability to eat, and tolerance for certain food. Alternative feeding. This is a feeding method that is used to ensure adequate nutrition when the clients are unable to ingest their food. There are two types of alternative feeding methods, namely enteral feeding method and parenteral feeding method. Enteral feeding method. This is achieved by means of nasogastric tube. nasoenteric tubes, nasointestinal tube, and gastrotomy or jejunostomy tube. Nasogastric tube. It is inserted from one of the nostrils down the nasopharynx and into the alimentary tract. Nasoenteric tubes, nasointestinal tube. It is inserted from one of the nostrils down into the upper small intestine. It is longer than the nasogastric tube, at least 40 inches for an adult. Gastrostomy tube. It's placed surgically or by laparoscopy through the abdominal wall into the stomach. Jejunostomy tube. It's placed surgically or by laparoscopy through the abdominal wall into the stomach. Purpose and indication of enteral nutrition. Purpose of enteral nutrition: to provide adequate nutrition for patients. Indication for enteral nutrition: for client who is unable to ingest foods, for clients with impaired upper gastrointestinal tract, for clients with impaired or interrupted food transport into the small intestine. Enteral feedings are liquid mixtures of carbohydrate, protein, fat, minerals, vitamins, and water in required and specified proportions. To achieve optimal nutrition, enteral feedings must be a balanced diet. In this setting, enteral feedings can be prepared and mixed by the nurses in accordance to the client's body need or physician order using locally available menu diets such as maize pap, milk, sugar. Also, the normal regular diet can be blended with water, for example, rice and beans with fish. There are also prepared standard formulas that are commercially prepared. Enteral feedings can be administered intermittently or continuously through an open system, feeding barrel or syringe, or closed system, prefilled bottle with drip chamber. Parenteral feeding method. It is the intravenous administration of nutrient-based solutions of dextrose, water, fat, amino acid, electrolytes, vitamins, and trace elements through a venous access device. Parenteral nutrition can be administered through a central venous access, often the superior vena cava, and usually for duration of 7 days or more. It can also be administered through a peripheral venous access, PICTO, through a peripheral venous access, which is indicated for patients requiring parenteral nutrition for less than 7 days. Purpose: to provide nutrients required for the normal metabolism, tissue maintenance, repair and energy demands in clients who are unable to receive or tolerate adequate nutrition through the GIT. Parenteral feeding method. Indication for parenteral nutrition. It is indicated in the following conditions: gastrointestinal tract malfunctioning due interruption in its continuity or impairment in its absorptive capacity. 1. Paralytic ileus. 2. Intestinal obstruction. 3. Inflammatory bowel disease. 4. Ulcerative colitis. 5. Short bowel syndrome. 6. Malabsorption. 7. Gastrointestinal fistula. 8. Persistent vomiting. 9. Hepatic failure. 10. Acute pancreatitis. Parenteral feeding method. In hypermetabolic state for which enteral nutrition is not possible or inadequate, severe burn injury, acute renal failure, multiple fracture, tumor of the GIT tract, major surgeries with nil per oral order for more than 5 days. Patients at risk for malnutrition because of 1. Metastatic cancer. 2. Gross underweight more than 80% below standard. 3. Nil per oral order for more than 5 days. Having taken you through the overview of patients' nutrition, it is anticipated that you can now identify nursing interventions needed for optimal nutrition for clients, alternative feeding methods, and terminologies used to describe hospital diet. Summary of Study Session 2. In Study Session 2, you have learned about 1. Nutrition-based nursing intervention that can help to promote optimal nutrition in hospitalized clients. Different terms used to describe the diet served in the hospital in patient management. Alternative feeding methods, which is divided into enteral and parenteral nutrition. Overview of patient's nutrition. Nurses have a responsibility to maintain health and facilitate patient recovery from illness through promotion of optimal nutrition and provision of a balanced diet to the client. To achieve nutritional-based set goal in client care, collaboration with physician and dietitian is very essential. A balanced diet can be obtained through the use of locally available food. End of Study Session 2. Thanks for listening.